Hi, I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. Here's the skinny, as they say, for you on the Editor's Choice and Highlights articles in the October 2015 issue of Mayo Clinic Proceedings. You can access the articles that I'll mention here for free on our website at least during the month of October, and some of them even for 60 days. Our Editor's Choice this month is a special article about the often discussed risks of ionizing radiation at the levels used in medical imaging. Dr. Cynthia McCullough, who is a medical physicist from Mayo Clinic in Rochester, and several of her colleagues rephrase and answer common questions about CT scanning and radiation. And that's really important because there remains considerable controversy about the question of whether and to what extent CT scans might increase the risk of future malignancies. It's not at all uncommon that clinicians refrain from ordering medically appropriate CT exams because of well-intentioned but somewhat misinformed concerns. The author's goal here is to provide physicians with accurate information on which they can base their clinical decision-making and respond to patient questions. One of our highlights this month is once again the latest contribution to our symposium on neoplastic hematology and medical oncology. This time, Dr. Thomas Smith and Ms. Catherine Saiki from Johns Hopkins University in Baltimore, Maryland, discuss the management of cancer pain. The authors provide a brief overview of the mechanisms and types of pain, and they review current, new and promising approaches to its management. This is a common and very important problem because, for a variety of reasons, pain remains poorly controlled in nearly half of all cancer patients. And suboptimal pain management, as you can imagine, can have devastating effects on the quality of life and on physical functioning. And of course, it increases and compounds the psychological distress related to just having cancer. Our second highlight this month is an original article which addresses the 10% of statin users who report presumably statin-related musculoskeletal symptoms such as myalgias, cramps, and weakness. Dr. Paul Williams from Lawrence Berkeley National Laboratory in Berkeley, California, and Dr. Paul Thompson from the Hartford Hospital in Connecticut analyzed data from the National Runners and Walkers Health Study, a very large epidemiological cohort specifically created to study the health benefits of exercise. And they examined whether and to what extent incident high cholesterol and statin use are related to decreases in physical activity over time. This is a complex issue because on the one hand, statins could reduce exercise activity. On the other hand, lower exercise levels could increase the risk for hypercholesterolemia and thereby prompt statin treatment. What do you think the authors found? Take a look at the article to find out. And the third highlight in the October 2015 issue is a concise review for clinicians on food allergies that was authored by Drs. Bhavisha Patel and Gerald Volchek from Mayo Clinic in Rochester. You're all seeing in your practices that food allergies are a growing concern. It's really important for patients and for practitioners to be able to recognize the symptoms of food allergies, to know common food allergens, and to understand the management of reactions. This review here covers all of these issues for you. And if you complete the appropriate documentation, you can get up to 1 hour of CME credit for reading this concise review and also for the symposium article on the management of cancer pain that I had mentioned earlier. To read these and many other free articles, please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. And while you're there, follow the links that connect you with us on Facebook, Twitter, and YouTube. This way, you can keep up to date easily on what's happening at Proceedings between our monthly issues. And not long now, and I'll get to tell you about the November 2015 issue. See you then. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.